I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf and this episode is everything you need to know about sleep and menopause and all the different changes that happen. Before I get into this episode, I want to make it clear that it's definitely not any type of medical advice. If you have any questions about your health, make sure you go speak with your healthcare provider. And this is definitely not any advice on religions. If you have any questions about your religion, make sure you go speak with your friendly neighborhood religious leader. This is a Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I am super excited to have on with me Dr. Andrea Matsumura. Fantastic. Dr. Matsumura, if you could please introduce yourself to the viewers and the listeners out there that may not know you, that would be great.
Sure. So my name is Andrea Matsumura. I am double board certified in internal medicine and sleep medicine, and I am certified with the Menopause Society for Menopause Care. I have a website called Sleep Goddess MD that has a lot of free information. And I am going to be coming out with a chronic insomnia guide for purchase that will be on my website in about 4 weeks.
Amazing. So let's get into it. So you're known as the sleep goddess. That sounds so fancy. Tell me, can you share with us how you earned that title and what inspired your passion for helping people sleep better?
Well, so, let's start with how did I get to become a sleep medicine doc? Because I was practicing internal medicine for about 13 years. And at the end of almost every visit, people would say, oh, hey, I'm having trouble sleeping. And,
It's always at the end of a visit,
yep.
right?
And I did my best. I gave people a lot of sleep aids that I probably shouldn't have, but I started to notice patterns around chronic disease management, the inability to manage these disease states, and then started to really read more about sleep apnea, and then kind of got down into the weeds a bit about the fact that sleep is truly your foundation. And without sleep, nothing else is really going to work that well. There's no medication in the world that is going to fix your problem the way that it can, or the way that your life can be improved upon without actually getting that foundational sleep. So I went back to school after 13 years and did a fellowship in sleep medicine. And then I started to get so many women who were having trouble sleeping, who were in midlife. And I realized that menopause was this signal in our life that was rather disruptive to our sleep architecture and our ability to get to sleep and stay asleep. And then did a deep dive on all of our hormones that affect our sleep: estrogen, progesterone, testosterone, melatonin. These are intimately involved in our ability to get to sleep and stay asleep. I love Greek mythology. So as I was developing my brand, I went down that road, and somebody mentioned that I sound like a sleep goddess, and it kind of stuck.
That's amazing.
So that's
I
my
love
story.
it. Love it. That is fantastic. And who doesn't want to be called a goddess, right? Like, come on.
Well, exactly. So that's my point. I am the sleep goddess MD, but it's so that I can help people sleep like a goddess
Ooh.
in their own bed.
So tell me that sleep is often called the third pillar of health, alongside nutrition and exercise. Why do you think it's so often neglected?
Well, we live in a society where we don't we do not condone sleep. We always say things like, "Well, I'll sleep when I'm dead," or "the early bird catches the worm." All of those phrases, and we do not understand how important and vital sleep really is. We're supposed to sleep a third of our life.
Hmm.
That's a lot when you think about it.
That's a lot.
And I would argue that yes, sleep is one of the three main pillars, but it is the most important pillar. Again, you can't exercise your way out of bad health.
Yeah.
You can't exercise your way out, or nutrition, is not going to work as well if you're not dealing with that foundation of sleep. So, you have people come to you who say, I'm eating right, I'm doing all the things, I'm exercising. And then that you ask them about their sleep and they're not getting enough sleep. And seriously, I have seen it over and over. People who invest in their sleep, who make sleep the priority, then everything starts to fall into place.
Oh, you're so right. I mean, when you're exhausted, how are you going to make good decisions, right? How are you going to have a good relationship? How are you going to do anything? How are you going to function? I mean, that brain fog is going to get even worse when you're not sleeping. And that's why we know that so many women in midlife suffer because of, the hot flashes, the night sweats, and then they're not sleeping. And then they wake up at 3 a.m. and they can't go back to sleep.
Yeah.
And then they're just exhausted the next day. And then we expect them to be lifting heavy weights and eating protein when they haven't even slept 8 hours, right?
Right.
So many of our listeners are women in midlife who struggle with insomnia, night sweats, and restless sleep, like we were just talking about. So, what are the biggest sleep disruptors during perimenopause and menopause that you've noted?
Well, for a lot of women, they will develop chronic insomnia, and then they develop this anticipatory anxiety, and then it becomes this vicious cycle. And then, postmenopausal women, 60 up to 67% of postmenopausal women will have sleep apnea.
Mm,
90% of those women do not know that they have it. We are not
interesting.
screening. We do not have a good screening tool. We don't know how to identify a sleep disorder early, and
Yeah.
so women live with untreated illness in the sleep department for years before. I like to say that there's a handful of us in our sleep community that really provide this holistic, integrated approach, because it's not just, oh, are you not breathing correctly in your sleep? Or, oh, you just have chronic insomnia. I argue that chronic insomnia is a comorbid condition. There is something underlying that is driving the insomnia, and you have to treat both or you're not going to be successful.
Hmm. Yeah. So, how can hormone changes impact our circadian rhythm and sleep quality? And what do you think are the best strategies to help rebalance them?
Yeah, so estrogen helps us stay asleep. It works. There's receptors in the brain. It also modulates melatonin. So how does it do that? So um, estrogen modulates serotonin. Serotonin is a precursor to melatonin. And
Hmm.
so I am convinced that melatonin plays a really big role in perhaps the high rates of dementia in women. Since 2/3 of all cases of dementia are in women, it's not only estrogen that is affecting this, but it is also your melatonin. I think we get two hits basically, because it is natural aging that we have a reduction in melatonin. But then when you have this estrogen imbalance and you have this reduction in estrogen, then that's also affecting your ability to produce melatonin. So estrogen really helps us stay asleep. Progesterone is that it enhances that GABA pathway for relaxation. So progesterone is that hormone that helps us get calm, prepares us for sleep. Estrogen is really, uh, since it works so closely with melatonin, it's really the circadian regulator. And so if you have these imbalances, then you are going to have more trouble getting to sleep and staying asleep. And the thing that we talk about a lot is the vasomotor instability with the big excursions of estrogen. But in reality, it also affects the circadian rhythm, our ability to have this routine of getting to sleep and staying asleep, the homeostasis of sleep.
So interesting. I never knew that. So do you think those individuals that are on like SSRIs, do you think they get better sleep?
There's no data that shows that it does affect REM sleep. So there is some changes in sleep architecture. And there might be some reason why SSRIs are used for vasomotor instability, because it's
Mm.
helping to reduce the mechanisms that are in the brain, I think, that are actually causing that circadian instability.
Yeah, yeah. So just for the listeners and the viewers out there that may not know what a SSRI is. So SSRI stands for selective serotonin reuptake inhibitor. So that's what we're
Mhm.
talking about. So we're preventing that serotonin from being taken back up. And so what Dr. Matsumura was just saying is that serotonin is a precursor to melatonin. So if we're preventing serotonin from being reuptaken, then we would hypothetically increase that melatonin, right?
Right, but we don't know if it's dose dependent. We don't know if it's sustained long term. We don't really have that data.
Hmm. Okay. Yeah, so interesting. So there's so much advice online, like weighted blankets, blue light glasses, magnesium. What do you think is worth trying? What do you think is just kind of like not snake oil, like not really true?
Yeah, it's so hard, right? So, for instance, weighted blankets, they're not going to help you if you have hormonal insomnia,
Yeah.
you know, right? Magnesium's not going to help you if you have chronic anxiety. It's these are so I say that these things are good adjuncts, but they are not silver bullets. So they may be part of your toolkit to help you get to sleep, but again, you have to get down to the root cause. So that example of the weighted blanket, if hormonal shifts are causing the insomnia, there's no amount of weight in a
Yeah.
blanket that is going to actually
That's
help
right.
you get
Hmm.
to sleep. So you
Yeah.
really have to focus on what is it that is driving the insomnia, the inability to get to sleep.
But what about those blue lights? I don't even think is that like for like screens? Is
Yeah.
that what that is?
Yeah, because the most sensitive way that our circadian rhythm changes is with a light. We've got these nerve cells in our eye that connect directly to the wake center, and so that helps to set and anchor circadian wake cycle. So the thought of using these blue light blocking glasses, the blue glasses, they are supposed to block that light so that your brain is not thinking, oh, I should be awake. They're kind
Mm,
of they're meh to me. We really just need to learn how to remove electronics from our life in the
yes,
evening so that we are not giving our brain mixed messages.
absolutely. So for those individuals that let's say they're waking up at 2 a.m., right? Which 2 a.m., 3 a.m., and then they're not able to go back to sleep.
Mhm.
Do you have any advice on what would help them go back to sleep? I saw actually somebody had mentioned EMDR. What do you think about that?
So EMDR is a therapeutic intervention where you learn this technique. That's really for a specific reason why you are waking up, right? It's not kind of
Mm.
this general, this is what you should do. The quick answer is if you cannot fall back to sleep and you're waking up in the middle of the night, sounds counterintuitive, but you have to get out of bed because
Oh,
it's called, the fancy word for this, and this is part of my cognitive behavioral therapy for insomnia, my toolkit. This is part of one of the foundations of treating chronic insomnia. It
mm.
is called stimulus control. That is a fancy word for saying we don't want your brain to associate the bed with anxiety and not getting to sleep. So
Oh,
it's all about brain training. So if you're
mm.
lying in bed, tossing and turning and ruminating and thinking, oh my God, when am I going to get back to sleep? Oh my goodness. Right. So then your brain starts to think, oh, that's what I'm supposed to do in bed. So you want to get out of bed, have a plan. I elaborate on all of this in this toolkit where you have a plan. I'm going to do A, I'm going to do B, I'm going to do C, and you pick a spot in your home. And then when you're able to feel sleepy enough, then you get yourself back into bed. And, you know, what I always tell folks is that the treatment for chronic insomnia is not comfortable. It's not a couch to 5K, it's a couch to marathon. But you came to me because you're having trouble sleeping, and it has been years for most people. And 3 or 6 months of some hard work is going to set yourself up for success for the rest of the decades of life that you have left to live.
Yeah. You know what ends up happening, right, is when people get up, they'll like start scrolling on their phones.
Uh-huh.
And that's going to keep them up even longer because all of that blue light, right? Like that.
Yeah, so that's a big no. So in the
You're like, no.
in my toolkit, and what I say is these are the things that you should be thinking about doing. The most relaxing, boring thing you can read, listen to, something that helps to enhance the parasympathetic system rather than ignite the sympathetic system. So, no cooking, no cleaning, no working, no electronics, no exercising in the middle of the night to help
Yeah.
you get back to sleep. No.
I can't imagine like getting on the spin bike at 2 a.m.
Oh,
to go back.
some people make a whole pot of coffee.
Oh my goodness. Oh my goodness. Yeah, no, that's not what I would do. So what role do you think lifestyle changes like exercise, nutrition, mindfulness play in resetting our sleep patterns?
You know, those are all really important because when we exercise, it actually helps with our circadian rhythm. You know, following good nutrition principles around eating, vegetables, protein rich foods, our natural fruits that we can sustain with. All of that helps with our ability to actually balance blood sugar and stay asleep, right? So I consider exercise, nutrition, making sure that you're following a good sleep routine. These are the components and part of sleep medicine. They're not just lifestyle changes. It is sleep medicine doing those things, and it's actually one of the pieces to my dream sleep method because, again, I try to be holistic. I'm not just looking at, do you have trouble breathing, are you staying awake, why, like, we got to treat everything in order to
Mm.
help you be successful so that you can actually get to sleep and stay asleep.
You just mentioned something that I'm curious about, and I don't know. So hopefully you can tell me. How does exercise help rebalance the circadian rhythm?
Yeah, so we have this sleep homeostasis in our body. So when we wake up in the morning, our sleep pressure should be really low, and as the day progresses, sleep pressure increases, and that's through a few mechanisms that are occurring in the body. So, for instance, every reaction that happens in the brain all day is producing waste products, and adenosine is one of those. And adenosine is what makes us sleepy. So when we wake up in the morning, adenosine is low, adenosine increases. And then our circadian wake cycle is really high in the morning and then goes down throughout the day. That's the sleep homeostasis. When we exercise, people are exercising during the day. Very few people exercise late at night, right before bed. That helps to fire off that circadian wake cycle. It helps to bring that stimulation to the body. It helps
Mm,
to stay awake and fire off all the processes around wakefulness, and then it also helps to then balance that sleep pressure for the day. So it really helps with circadian realignment. There are very few people who can actually work out vigorously and then fall right to sleep.
mm,
What I
yeah.
always say is that the person knows themselves the best. And if that works for them, I'm not going to mess with it. But I know for myself, if I exercise too late, I'm not getting to bed when I
Yeah.
want to get to bed. It's too stimulating.
Right. Right. Absolutely. So, what's the biggest myth about sleep that you wish you could just get rid of once and for all?
The biggest myth around sleep is that you can't really catch up on on your sleep. I mean, you can't catch up on the weekends. You can't, like, I'm just going to run, 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 and then eventually, our bodies compensate, sure, but at some point our bodies give up, and chasing chasing sleep is always going to come back to rear its ugly head. So we really need to prioritize it. That is the misconception that we can always make up for it later. It's not true.
You hear that all the time, right? I mean, like, I know I hear that. And being an OBGYN and being sleep deprived for like 25 years of my life, I can't make that up. But yeah, I mean, you hear people say, like, well, I didn't get enough sleep, but I'll just sleep on the weekend and that'll be fine. But, you're like, that's just not the way it works, huh?
Yeah, it's like a bank account, right? So if you have such a deficit in your bank account, 2 days isn't going to cut it to balance it out, and so you're running in this chronic deficit, and
Mm,
then our bodies definitely start to show that to us. You know,
yeah.
w- Again, one of the most common ones is I can't lose weight. And
Yeah.
so once we figure out, if there's no other organic medical cause for your inability to lose weight, a lot, when people start on weight loss medications, one of the core components is you've got to get enough sleep.
So why is that? Maybe you can expand on that a little bit. Why is weight management and sleep correlated?
Because it's all about hormone balance. So when we
Mm,
sleep, our body is, I like to say the organs in our body are conducting a symphony.
yeah.
And if we do not get into the right stages of sleep, because every stage has a purpose, and certain stages are very important to the restoration of the body. And if we don't get into the right stages of sleep and get enough of each stage of sleep, then the all of the hormones that regulate satiety, that regulate our hunger cues, they're off.
Mm.
The balance is off. And so without getting enough sleep, you're always kind of chasing your tail.
It's so important. And I'm so glad you mentioned that. We know so many women in midlife, right, that are struggling to get enough sleep, sleep through the night. So this is all so, so important. So, we know that poor sleep is linked to everything. You just mentioned weight gain. What about heart disease? What's one health benefit of good sleep that people just don't realize?
Yeah. So we do know that with chronic sleep insufficiency, is higher prevalence of, hypertension, heart disease, depression, diabetes, and especially in the setting of sleep apnea, which is an oxygen deprivation state. So
Mm,
by virtue of having sleep apnea, you're having these decreases in what is norm for you and your oxygen level, and so then that puts a lot of strain on your heart, your lungs, your brain, and it has all of these cascading effects on the rest of your body. So yes, and it is, if you have sleep apnea, depending on the level of sleep apnea you can have up to a 25% increased risk of heart attacks or strokes.
wow, that is a really big percentage. I had no idea. That's crazy. So, since for women that are really already struggling with like brain fog and fatigue in midlife, how do you think sleep could transform their life?
Well, sleep is going to be foundational in their ability to reset, their ability to really have everything else kind of fall into place. I would say to my patients over and over that sleep is the juggernaut. And if you're
Mm,
struggling with brain fog, you're struggling with daytime fatigue, every increment of 15 minutes counts, because one of the things that people kind of fall into is similar to when we counsel people on exercise, right? They think that they need to go run a marathon, right? So I want people to understand that you don't have to get, X amount of hours of sleep or else everything's going to fall apart, right? It's all about getting high quality sleep. It's all about getting consistent with your sleep. So if you do great at 6.5 hours and you consistently go to bed at the same time, wake up at the same time, stay asleep, you wake up feeling refreshed, that's good. But it's that inability to get to sleep and stay asleep, similar to what you are referring to, where maybe a couple of nights you're sleeping 4 hours and then your body's so exhausted you get 8 hours, and then you go back to 4 hours, and then you slept 6 hours, and then you went to bed, really early and slept 10 hours. That inconsistency is what just feeds on the brain fog. You're never going to get rid of it until you get consistent.
So you think that, like, let's say you have a routine during the weekday, but you kind of let yourself sleep in on the weekends and stuff like that. Do you think that's bad? Do you think that, or you think that we should just be consistent, just to, like, ideal, in an ideal world, like sleeping 10 to 6 every day?
That is my one piece of advice. If I could give that one piece of advice to everyone, is be consistent. It definitely is not sexy. It sounds like it's super, logical, basic, right? But if we go to bed at the same time and wake up at the same time every day, even on the weekends, you're doing yourself a really big favor. So think about our cues, like brushing teeth, right? We don't brush our teeth, at 8 o'clock one morning and then wait till 11 the next morning. Our body, we have developed this external cue that when I wake up 30 minutes later, whatever, 10 minutes later, 5 minutes, you have this routine. What's the same thing? Our body loves routine. It's just
Hmm.
like eating, we know, oh, I'm hungry. I usually eat around, 12:30, 1 o'clock, whatever it is. And it's 3 o'clock. I'm ravenous, right? Because our body is used to, okay, I eat at whatever, 7, then I eat at 12, then I eat at 5. And your body is used to it. You don't have these white excursions. Well, today I'm going to eat at 7 and tomorrow I'm just going to wait and eat at 10 o'clock. And then, I'm just going to eat at 2. And, it's not irregular. Well,
Right.
it's the same principle. We need to be regular and consistent about our bedtime and wake time.
Well, why is that? Just so if I can just prod a little bit more, like, why is it so important to have these consistent times, whatever your time is, right?
Right, right. It's because that goes back to that sleep homeostasis. It goes back to that circadian wake cycle, the way that our body balances wake and sleep. And if we're giving it mixed signals, then our body's saying, well, I'm not sure. Like, I haven't built up enough sleep pressure for today, and now I'm going to bed really early. Or, wow, we're staying up really late and I'm not sure what we're doing. So our body really relies on these external cues, and so that we can internally set that circadian rhythm.
I had no idea how important setting a time. I thought that was just like for little babies and kids, but I think adults need that too, huh? They need a bedtime.
Yeah.
So that's such important information. Since you're the sleep goddess, right? I have to ask. So, tell me about your sleep routine. What do you do? What do you do to prepare to go to bed? Do you shut off all the lights? Do you, like, lock up your electronics? What do you do?
Yeah. So first off, I always say cool, dark, quiet. So those are the big three. And I cannot sleep with any light. I am very sensitive. So I actually wear an eye mask to bed, because if I tend to roll over and I don't have blackout shades, then and it's light out, then that's the end of it for me. I'm awake. So cool, dark, quiet. I usually wind down about an hour before I go to bed. I actually do a stretching routine now. Um,
Hmm.
and definitely has to be, again, dark, cool, quiet. I really try hard not to bring any electronics into my bed. I tell people, if you need to use your phone as your alarm clock, put it in a drawer so that you have to see the light. We can hear it. Um, that is the biggest thing. We have way too much light in our life, and it is actually shorting our total sleep time in the world.
Mm, so interesting. I had no idea. And so, if you could have a magic wand and give every woman better sleep habit tonight, what would that be?
So that goes back to that routine, being
Okay.
consistent.
Yeah.
It's going to bed at the same time, waking up at the same time. If you start with that one piece, you're going to be making a lot of headway.
Okay. So that is probably like the biggest takeaway, huh? Is that creating a routine and getting all electronics out. And you said cool, dark, and quiet. Is that what you
Mm-hmm.
said?
Yep.
Cool, dark, and
Cool,
quiet.
dark, and quiet, setting a routine, giving yourself time to wind down. Another example I give people is, when we're hungry, we don't just go, 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 open up the refrigerator and just start shoveling food in our mouth. No, right? We prepare our food, right? Well, it's the same thing. You have to prepare your brain, your body for sleep.
Yeah, I mean, there's so many people that struggle with sleep. I know, my husband's always complaining about his sleep, but then he's always on his phone. And I'm like,
Yeah.
well, of course you're not getting sleep because you're always on your phone. So, anyways, but yeah, I mean, it's just so I had no idea that it was so important to have such a consistent routine. But listening to the sleep goddess, I'm I'm gonna have to make sure that I have and absolutely have a fantastic routine. I'm gonna change it tonight, actually. I'm gonna try to
Yeah.
be very consistent about the sleep time and wake time. I always thought that it was a good idea to let yourself sleep in and just kind of listen to your body, but you're like, no, just have it be more consistent.
Yeah, I mean, so it's a balance, right? Clearly, if you're really chronically sleep deprived, listening to your body and staying in bed for a little bit longer is probably going to be helpful. But at the end of the day, if you're not consistent, then you're always going to be chasing that sleep, right? And just one of the issues, especially in menopause, is that, and why I decided to pursue this and become, the sleep expert, thought leader, and also midlife uh, practitioner, is because a third of women who start on hormone optimization still have trouble sleeping.
Mm. So how do you fix that?
So we get down into the weeds. I pretty much don't leave any stone unturned, and
Yeah,
that goes back to this method. It's called dream. So your daily habits, your resting environment, your emotions, what is your archetype, which is basically what is your circadian rhythm, and then medical conditions, like what else could be going on. So
sure.
like one of the more common abnormalities, especially in postmenopausal women, is restless leg syndrome. And that's rarely identified. And it's something as basic as making sure that you're getting enough iron, because if brain iron stores are low, that affects our ability to actually sleep. And it causes this movement disorder. And ferritin has this wide normal range, and if you have restless leg syndrome or periodic limb movement disorder, they're actually two separate things. The recommendation is that your ferritin level be above 100. And,
Mm.
usually there's people don't realize that, and most docs don't realize that.
I didn't know that at all. So that's really interesting. Yeah, to have your ferritin level greater than 100. So you're saying to have your iron stores really up high so you don't have this restless leg syndrome. Really interesting. So if you were to, tell me what you would recommend, one thing, right? One thing. So you talked about the pearl, you talked about having a consistent sleep routine, but one thing that you would advise women besides having a routine, do you think that in postmenopause, you think that hormones make a significant difference? What do you think about midlife and hormones and sleep in menopause?
Yeah. Well, after struggling through my own personal journey through menopause and not recognizing myself, and then really teaching myself, finding the articles, because I will say that our medical education is woefully behind in how these hormones are intimately involved in virtually every cell of our body. I'd say that the first thing is to have that conversation with a menopause provider, somebody who understands menopause, to see if this could be helpful. And there are the more I read, and I know you as an OB-GYN, I mean, there's not that many people who can't take hormones,
Yeah.
right?
Yeah, absolutely. Yep.
Right. And
100%.
and so my analogy with that is, if our thyroid stops working, we replace thyroid hormone, right? If
Yeah.
the pancreas stops working and doesn't produce insulin, we replace insulin, right? So,
Absolutely.
so
100%. Yeah.
I'm thinking, why is there such debate? My ovaries stop working. That I have to just live this way. So
Yeah.
that's my plug for: do the due diligence, get the full workup.
Yeah.
And once you're on hormones, if you still have trouble sleeping, because 33% of women will continue, then let's talk. Let's figure this out.
Yeah. Yeah, absolutely. One thing that you said that I thought was really interesting is that you said if you are up and you continue to stay up to get out of bed, I would think that I would need to just lie there and just try to force myself to try to go back to bed instead of getting up, because then I wonder, like, if it becomes a habit of, like, every time you can't fall asleep, you get up out of bed. And do you think it kind of backfires?
No, no.
No.
What backfires is staying in bed. And so
Mm,
that's because, again, the brain is just another muscle and the body
mm,
is what I like to say. And you're training it then to stay awake in the place that you want it to fall asleep. So
mm.
what you need to do is get out of bed, pick a spot that's really relaxing. I usually tell people, pick your insomnia chair, pick your insomnia sofa, whatever, a really relaxing spot. And then you have a plan. I'm going to do this relaxation exercise. I'm going to do this imagery work. I'm going to read this really boring book. I'm going to listen, for 5 seconds. I'm going to use my phone, but get to a point where I can listen to these, relaxing beats,
Right, right.
whatever it is to get you back to this state of ultimate relaxation and sleepiness. And then you get back into your bed to fall asleep. And,
Yeah.
it does again sound counterintuitive, but over time, that period of wakefulness shrinks.
Mm, mm. So good. So good. So, Dr. Matsumura, for those people that are listening and watching and thinking, like, oh my God, the sleep goddess is so fantastic. I have to have her in my life. I can't fall asleep. I don't know what the heck I'm doing. How can people get in touch with you? How can they reach out and perhaps make an appointment? Do you do telehealth? Tell us.
Yes, so I am in the state of Oregon, and
Okay.
so I do see patients in person or telehealth, but you do have to be in the state of Oregon. But I could see anybody who comes to see me in person. I do not have my practice open quite yet. This is also opening up in mid-September, and
Ooh.
I'm very excited to be able to offer a full practice where I am able to help people through sleep and hormone therapy at the same time. So that is going to be opening up in September. Some more to come. I uh, I will be in New York City October the 4th at a conference.
Ooh. Fun.
So it's called Luminescence. So there's a lot, but I have a lot of information on my website. I post articles out, and I have a blog, and then I've got this toolkit that's coming out as well.
Amazing. Well, thank you so much for coming on. I really appreciate your time. I know you are super busy, so I appreciate the fact that you took out the time to share your wisdom with our viewers and our listeners. So thank you so much.
Thanks.
Thanks
Thanks
for
for
coming on.
having me. And one last thing I forgot. I do have an
Yes,
Instagram account that gives little snippets, but I
yes,
like
do
I
it.
like to say it's called Sleep Goddess MD. I like to say though that, as you know, on Instagram, this is all about just arming yourself with advocacy, right?
Mhm.
So that's what it is. I provide people, 1 minute snippets so that they can be advocates for their own health.
Amazing. I love it. So, well, thank you again. Thanks for coming on. And well, it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you have any questions about your health, your sleep, any one of those things, make sure you go see your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.